any disease, we have to know that what is the disease itself. So what is cough? So what is cough? Anybody? Expectoration, no. Not always when we cough, we feel we have expectoration. Reflex, yes, in one sense. But that is a physiological performance, no. Actually, if I want to say pathology, what is it? Irritation of pharyngeal mucosa. So this is a reflex based on the irritation of the pharyngeal mucosa. And this acts as a protective mechanism like fevers, okay, inflammation. Cough is also a symptom which indicates something. So whenever we feel cough, what do we do with ourselves? Suppose घर पे कोई दवाई नहीं है, there is no medicine in your house, then what do you do usually? Pani, yes. Garam pani, yes. And? Vomiting. काढ़ा, yes. ये बहुत अच्छी चीज़ है. बहुत गंदा होता है खाने में, but it's very beneficial. Yeah. आजकल मुझे भी खिलाती है मेरी मम्मी. चलो कोई नहीं. Okay. What is काढ़ा actually? सब कुछ मिलाते हैं. हल्दी. बोलो जोर से बोलो, कोई प्रॉब्लम नहीं. अदरक, yes, ginger, okay. तुलसी. And ये तरह का बना के खिलाता है क्या कर रहा है? अच्छा. So it's actually a combination of certain herbs. Okay, and finally we usually mix a small amount of honey, right? Because honey it does two things. Honey दिखने में कैसा है? It's a viscous fluid, right? So it creates a layer. Plus honey actually creates some warmth in the area from where it's going. So overall एक soothing effect रहता है. ठीक है. So these are the home remedies what we do. Apart from this, we can do gargles with lukewarm saline water, etc., etc. Or medication में तो we have cough syrups. Benadryl, I gave it intentionally because once upon a time this was a very famous cough syrup, right? Now, whenever in case of some choking or some irritation, this usually does not need any treatment. Simple macular. Well, everybody is coughing, I also should cough. No? And I'm suffering from LRT, so I should cough more. So, usually what happens, whenever something stuck to your throat, so this is basically a protective reflex. That what is cough basically? It's a sudden expulsion of air in the lungs, right? So because of the expulsion क्या होता है कि वो air के force से that foreign body it used to expelled out, right? So this is the protective mechanism. Similarly, in case of any kind of infection, the first phase of any kind of chest infection or throat infection, there is increased pharyngeal secretions, right? Inflammation होगा तो secretion तो होगा because cell permeability increases. So they usually accumulates. And that accumulation is basically a party house of the microbes. I hope microbiology has covered your respiratory, right? This week or previous week? Started, right? Okay, yeah. We had a plan regarding that. So this is basically an alignment class. So in the microbiology, it has also been seen that there are many types of infection. Okay, so depending on the infection, it depends that what kind of treatment is needed. Okay, so usually in case of cough occurs because of cough reflex. So this induces coughing and the related expectoration. Expectoration क्या होता है? Whenever there is secretion of pulmonary or bronchial secretions, lung always try to expel out all those extra things. आज को ज़्यादा खांसी नहीं हो रही है क्या क्लास में? थोड़ा सा ज़्यादा हो रहा है आज क्लास में खांसी. मुझे लग रहा था आज क्लास में बहुत खांसी होगी. Jokes apart, please wait for a while. And which is initiated by irritation of the sensory receptors of the respiratory tract. So there are certain receptors which we also known as stress receptors. So they creates an impulse which is known as tussle impulse. Tussal. Tussle impulse. The tussle impulse when it reaches the respiratory center, it induces cough. ठीक है. So इसको treat करने के लिए we have to know that what type of cough the patient is having. The entire treatment scenario varies. So here we have basically two broad category of coughs. One is dry cough and one is productive cough. Dry cough कब होता है? Whenever there is a simple irritation, or there may be certain viral infection, ठीक है, and it is not related to any kind of secretion which is coming out, like हिंदी में जिसको बलगम बोलते हैं, which we say sputum, right? Sputum or certain bronchial secretions. Now, depending on the color of the sputum, also you can differentiate. Do you have any idea that what color can signify which type of infection? Sorry? थोड़ा जोर से बोलोगे. Brownish, yes. Blood, yes, good. Then? No, bile lung पे कहाँ से आएगा? Green color vomitus is bile, not cough, not sputum. Yeah, green color sputum is there. Actually not green, it's greenish blue. So this is usually indicates Pseudomonas infection. Okay. When the sputum is very thick and it's a bit dirty yellow, then it can induce some certain bacterial infection. Okay. If the viscosity is very less, okay, like it's like what we say, serous secretion. So that actually indicates, which is the commonest. If the secretion is not very viscous, it's a bit liquid, क्या infection हो सकता है? This indicates viral infection. Okay. So why I'm saying this? Depending on the organism and the type of sputum, it will vary. ठीक है. जैसे in case of TB also, there will be very high level of sputum production, may or may not be associated with expectoration of blood. ठीक है. तो TB का एक तरीका का treatment हो गया. ठीक है. Then if it is pneumococci or staphylococci or staph aureus, then the antibiotic spectrum is different. In case of viral, we don't need any kind of antibiotic unless the person is suffering from in viral infection, we usually don't need any kind of antibiotics or antiviral agents unless fill in the blanks. No, fast तो अच्छा virus होता है. Sometimes we may need to give high level of antibiotics or antiviral drugs in certain patients with viral infection. Common sense. If the person is immunocompromised, like taking high dose of steroids, जैसे organ transplantation पे हो गया. If the person is suffering from HIV/AIDS, ठीक है. And also there is one more color of sputum, that is black. What is it? If the person is black color sputum, black color sputum. Sorry? No, smoke. I'm talking about infections. Yeah, that's a good guess. Correct. If any person is trapped in some fire incident, so when he or she will inhale lots of smoke, then also the sputum will be black. Because the raw charcoal will come out. Apart from this, one infection.
Is it due to blood TB?
मैं बोल रहा हूँ black color का. Sorry? Anthracis. No, anthracis में actually black नहीं होता. It varies. It usually contains blood. This is aspergillus. This is a fungus. Aspergillosis. Okay. तो उसका भी ट्रीटमेंट अलग है. उसके हम लोग को एंटीफंगल ड्रग चाहिए. ठीक है. So now another thing is non-productive cough, which is usually occurs because of simple irritation. The most of you which you are having. Simple irritation. So in productive cough, we have to give this group of drugs, expectorants, and in case of non-productive cough, we have to stop the coughing by giving antitussive drugs. This is the entire classification. अब थोड़ा सा आते हैं थोड़ा सा मैनेजमेंट पे, because when we are discussing cough, we have to discuss about common cold. Okay. So whenever certain one more thing, cough most of the time is beneficial because it will help the respiratory tract to clean up. But sometimes if any person is suffering from prolapse, idea what is prolapse? Physical idea, what is prolapse in anatomy? Commonly, we have two types of prolapse, uterine prolapse and rectal prolapse. Uterus की anatomy याद है? What is the support? In particularly, suppose somebody has multi-gravida, जैसे 7-8 बच्चे हो गए, बहुत हैं, ठीक है? In that case, or certain older patients, which trauma हो गया, so in that case, that support of the uterus is weakened up. So uterus comes out from the cervix, ठीक है? In rectal prolapse also the matter is same. So जब भी हम लोग खांसते हैं, so there's an increase in the intra-abdominal pressure. As a result of that, that prolapse may become worse. The prolapse patient, if we are managing conservatively, or if there is a plan for surgery soon, so to prevent the severity of prolapse, we need to stop cough. Number one. Number two, hernia repair surgery, same. In case of hernia repair surgery, that also so the same. After the surgery, if the person has severe cough, then problem may happen. Similarly, after cataract surgery कैसे होती है? We have a small incision beside the cornea, ठीक है? फिर जो लेंस के कैप्सूल के अंदर पे जो मटेरियल होता है, which is basically the opaque thing, उसको निकालते हैं, and after that we put some artificial lens inside. But it takes some time to get fixed up. So by that time, we have to stop the person from vigorous shaking of head. खांसी के टाइम पे क्या होता है? So that's a vigorous type of shaking. So to prevent in those cases, coughing is bad. Okay, we have to stop coughing in those patients very aggressively. The patient should not cough. We may need to give multiple doses at a very high range. Also, there are drug-induced cough. We have captopril. This is an ACE inhibitor. What is ACE? Yes, somebody is correct. It is related with hypertension. Yeah, RAS, exactly. तो नाम क्या है? Any idea? याद है? ना AC का full form RAS कैसे हो गया? Angiotensin converting enzyme. ठीक है. So we have a drug captopril. Then some beta blockers, particularly the non-selective beta blockers. Then inhaled corticosteroids and chromoglycate because of the irritation, depend on the molecular size. Iodides and inhaled ethers. ठीक है. So they can cause cough. Infection-induced common cold, URTI, LRTI. Cough, खांसी होगा. This is the classification. Vicks कौन से ग्रुप आएगा? क्या हो? लोगेश आसमान से गिरे शायद. विक्स कौन से ग्रुप का आएगा? There's Pharyngeal Demulcents, Expectorants, Adjuvant Antitussives, and Antitussives. Let me explain which group does what. Pharyngeal Demulcents, they just will soothe your throat like honey. Expectorants, it will increase the expectoration. जैसे suppose बहुत severe infection हो गया, so your cough is very thickened out, निकल नहीं पा रहा, so we'll loosen up the sputum or mucus what has been accumulated, ताकि निकलना आसान हो जाए, which usually happens during certain infections, right? Agree or not? Okay. अगर agree नहीं होगा तो very मुंडी ऐसे ही लगेगा. So here we have two groups: secretion enhancers and mucolytics. The secretion enhancers, they will increase the secretion, and mucolytics, they will loosen up the thickened mucus. Then we have antitussives. They will just stop the cough reflex. This is important in case of non-productive cough because वहाँ पे निकलने के लिए कोई mucus है ही नहीं, ठीक है? So here this group of drugs is needed, and apart from this we have some adjuvant antitussives which usually helps. क्या बोलो? Ayurvedic है ना मैं यहाँ पे among this classification एक अपना classification invent कर दिया. Pharyngeal demulcents, expectorants, antitussives, adjuvant. Which side? Which group? Good. Pharyngeal Demulcents. It contains lozenges, syrups, glycerin, liqueurs. Liqueurs means some citrus food products which are irritant to your throat. ठीक है? Like lemon juice हो गया, then इमली हो गया, आमलों के हिंदी में क्या बोल रहे हैं? आमला, आमला, आमला का जूस हो गया, ठीक है? तो these are the things which comes under liqueurs. Then आगे तुम्हारा expectorants. They will just increase the level of secretion so that it may flush up your respiratory tract. ये हम लोग actually usually use नहीं करते, but among them only guaifenesin, balsam of Tolu and Vasaka. These three we use. What is Vasaka? Good. It's a very beautiful it's a beautiful expectorants. बहुत काम में आता है. बचपन में हम लोग बहुत खाते थे. And among these group, bromhexine, ambroxol is the most commonly used drugs. ठीक है? अरे यार क्या हो गया इसको कुछ? Acetylcysteine and carbocysteine, they are preserved for certain severe cases because this group of drugs have certain renal side effects. Which type of cough syrup you need now? अभी जिसने खासा, कौन खासा? You know? Who coughed out? Now, right now. मुझे लगता है इसने खासा है. बोलो, कौन सा लोगे? You have the combinations. Decide. Firstly, tell me which type of cough you have. खांसने का क्या है? Everybody is coughing. Which type of cough you are having? Dry or productive? Dry or productive? Yes, I'm asking you. Which type of cough you are having? Dry or productive? Sorry? Sorry?
Wet cough.
Wet cough. अच्छा, wet cough नहीं होता. We have the term is productive cough. Yes. So which type of cough syrup you will take? Can you see? इसलिए बोलता हूँ सामने आके बैठो. Okay. बोलो. You will take expectorants or you will take cough suppressant? In case of productive cough, you will take expectorants or cough suppressants. In case of productive cough, what will take? You will take cough suppressants or expectorants? Expectorants, right? Because we need to expel out all the secretions. In case of dry cough, as there is no expectoration, तो वहाँ पे देने का फायदा नहीं है. Right. And remember one thing, during your treatment process, whenever you will start expectorants in certain patients, initially then the cough will increase for at least 1 to 2 days, because then the body will try to expel out all those things. So cough is a process for that. It will decrease after that when there is a less amount of secretion, and simultaneously antibiotics will work. Okay, then these things goes on. Chala. Treatment of common cold. Mostly the causative thing is a viral origin. So antibiotics has a little value. You may give depending on the patient's condition and whether the patient is suffering from or has the chance to get infected by any secondaries. Okay. Some viral infections it needed, like smallpox, measles, because in those cases immunity becomes very low. So in that case, there's almost 100% chance that the person will suffer from any kind of infection. So as in those cases, prophylactic antibiotic add kar sakte ho. But apart from this, we can use antihistaminics, nasal decongestants, antitussives, and expectorants, because usually in common cold, the cough is dry cough. Okay. Treatment is symptomatic only, and causative pathogen it does not eliminate. It depends on our immunity and the associated management what you are doing. Okay. Then एक करके आते हैं. Firstly is the Pharyngeal Demulcents. So this is administered as lozenges, cough drops, tussles. So basically it creates an increased flow of saliva and it gives a soothing effect and a protective layer over the कहाँ पे? Over the pharynx. So this soothing effect and the protective layer creation, it will result in the generation of less cough reflexes, cough impulses, or we say tussle impulses. ठीक है? Ultimately target वही है. Expectorants, the drugs that aid in the expectoration or removal of the mucus. Two ways: either we may increase the mucus production, or we may reduce the viscosity of the secretion. Now, firstly, the drugs like potassium iodide, जो irritate करते हैं, guaifenesin, Vasaka, then potassium iodide, potassium citrate, ammonium chloride, they will just give irritant stimulation to the pharyngeal mucosa. So then this will loosening and thinning of the respiratory tract secretion and occur in response to this irritation. So ammonium chloride, once upon a time, it was very commonly used. I have been certain movies also, in World War II movies. You have seen one small bottle they used to keep in front of the soldier's nose, and they feel stimulated. Okay, that one is actually ammonium chloride. It's very irritant. Chemistry lab पे किसी ने experiment किया ammonium chloride के साथ? 11-12 chemistry? We used to do ammonium hydroxide and ACl mix कर दो, धुआं निकलेगा, पूरा घर सोचेंगे कि आग लग गई, सब भागना शुरू करते हैं. We have done it in our house. Then there may be direct stimulation of the secretory glands. So that will result into the increase in the production of the respiratory tract fluid. जैसे iodinated glycerol, potassium iodide, guaifenesin. ठीक है? Then when we can use it? Whenever we feel that the person is suffering from productive cough, common cold, bronchitis, laryngitis, pharyngitis, and cough caused by chronic paranasal sinusitis. Usually we call it a sinus. Okay. Most commonly यहाँ पे कौन सा sinus है? The most commonly involved sinus is this. Maxillary, yes. The most commonly involved sinusitis is maxillary sinusitis. Next. How many sinuses are there, by the way? कितने? 4 types, not 4. Total 4 into 2, 8 है. Then we have cough suppressants. Drugs which inhibit the cough reflex by acting on cough center in the medulla. Where we use it? We use in dry and irritant cough. And also post-surgically in अभी बोला था cataract, yes. Then transplant, nah. ट्रांसप्लांट पे बहुत अच्छे से लगाते हैं हम लोग, छूटेगा नहीं, काशी से तो नहीं छूटेगा. कैटरेक्ट एंड और एक था सर्जरी, हर्निया and uterine prolapse, rectal prolapse. In those cases, even the cough is productive, we have to stop it. Some contraindication: should not be used in productive cough or elderly or a neurologically impaired patient, and should not be used in children. Why in neurologically impaired? Because all the cough suppressants, they act on the opioid receptors. So we have opioids, nowadays we don't use it. Codeine, it is available till date, and this is basically a drug of abuse. Codex का नाम सुने हो कभी? Newspaper में बहुत आता है. So codeine phosphate is Codex. Okay, this is not available legally, and there are lots of legal obligations to store and sell this drug. But nowadays we use this drug, Dextromethorphan and clofidogrel. But that also, as they act on the opioid receptors, so it will cause certain level of respiratory depression. Okay, and as a result, there may be respiratory acidosis because CO2 will accumulate. So that's why it is not indicated in case of neurologically impaired patients and in case of children. Okay. Cough suppressants, they are contraindicated below the age of 6, and from 6 to 12 years of age, the dose is it should be very less, particularly of dextromethorphan. Okay. What is the mechanism? It suppresses the cough reflex by direct action on the cough center in the medulla. Non-opioids, we have dextromethorphan, we have noscapine, we have clofidranol. Dose देखो थोड़ा सा vary करेगा, ठीक है. Plus point is that it does not have any property on narcosis, analgesic, no dependence potential, and opioid का सबसे important जो side effect है, that is constipation. All side effect of morphine and other related opioids, they have certain level of resistance or tolerance, except constipation. And this is an important MCQ. Okay. Side effects: dizziness, drowsiness, nausea, dryness of mouth, vertigo, irritability. And in case of opioids, सबसे important क्या है? Addiction, abuse liability. There are certain drugs which act on the cough receptors or stress receptor, what is it? So there are certain drugs which is once upon a time was very popular, but day to day its efficacy is becoming less, and there are lots of potential problems. We had benzonatate, levodopa, lignocaine, and prinoxidazole. The prinoxidazole was the most important drug which was used, but the efficacy on long-term use has seen that it is not that much of efficacious. So nowadays this drug is potentially banned. क्या कहते हैं? Desensitizes pulmonary stress receptors. ठीक है? Benzonatate act on the cough receptors in the lungs, central action causing sedation and headache, and that's why it should not be used in children. Most commonly used drugs. This is mucolytics. Almost all the preparations you will get at least one mucolytic acid. Bromhexine तो हमेशा मिलेगा. Apart from this, we have acetylcysteine and we have L-cysteine derivatives, means carbocysteine. So acetylcysteine usually is given to the patients. Particularly, this is important in case of COPD patients, COPD and elderly. Two types of preparations are available. One is effervescent tablets and one is injection. What is effervescent tablet? Bubbles, yeah. We don't give it as a tablet directly. We mix it with water. Advantage is that because as we are mixing in the water, it does two things. One, it creates a layer over the pharyngeal mucosa because wahi se jayega andar pe, and then the absorption becomes fast. Okay, and the mechanism is that it actually breakens up your this mucopolysaccharide chain. Usually होता क्या है? In case of thick mucus secretion, there is intense mucopolysaccharide chain bonding. एक नेट की तरह काम करता है. That's why the viscosity is very high. So it breaks those mucopolysaccharide polymers. It liberates lysosomal enzymes which further liquefies this, and the fibers in the tenacious sputum is broken. तो जब viscosity कम होगा तो इसका निकलना भी आसान हो जाएगा. ठीक है. So as a result, the mucus accumulation becomes lowered comparatively. Side effect rhinorrhea. The reason is same because of the lowering of the viscosity, lacrimation and gastric irritation. Okay. Then we have nasal congestion. What is nasal congestion? The earliest symptom of common cold. You'll see some heaviness over the nose. Okay. Then there may be nose block, what you say usually, right? You won't be able to take proper breathing from your nose. What is the reason? The reason is turbinate hypertrophy. Remember nasal turbinates? Turbinates, yeah, that from anatomy. ENT vibhag here. This is a very important topic in anatomy. ENT. It's basically to create a turbulent flow inside the nostril so that drying up does not happen. So there are certain blockings. Total there are 3 turbinates each size: superior, middle, inferior. In case of any inflammation, or maybe after a certain trauma or some allergic reactions, blood flow in the turbinates increased. Okay. So as a result of this increment, the turbinates, in the turbinates, there is a congestion of blood. And because of the congestion, the size of the turbinates becomes enlarged. Okay. Now, normally, अगर किसी को deviated nasal septum नहीं है, then mild hypertrophy does not create any problem. But unluckily, 99.9% of humans have certain grade of DNS, deviated nasal septum. सबको है, तेरे को भी है तो मुझे भी है. You can see my nose. Is it 100% straight? See yours. See your friends. Very rarely you will find straight. आप सब नाक देख रहे हैं दूसरे का. ठीक है. So this is known as DNS. So as a result of DNS होता क्या है कि one side is always more blocked. ठीक है. The space, the nostril space in one side, or sometimes if there is complicated deviation, then the both side may become blocked. तो जिस साइड पे ब्लॉकेट है, जैसे मेरा इस साइड पे थोड़ा सा, it's not pathological, I don't need any kind of treatment, but this side usually blocks the earliest. ठीक है. So this is known as nasal congestion. Apart from this, there is excessive nasal secretion. सर्दी पे तो होता ही, नाक से हमेशा पानी झड़ते रहेगा, which is very much irritating, right? Then inflamed and swollen nasal mucosa. So because of the overall reason, nose is blocked. So हमारा target क्या है? First target is to decrease the blood flow. Okay. So there are nasal. So in those cases, we use nasal decongestant drugs. So two forms are available. One is oral tablets, and one is nasal spray. एक नाम बोलो. Nasal spray, decongestant. Otrivin. What is the combination? Make a habit of looking at the combination. This is important. It contains oxymetazoline. This is a pure nasal decongestants. The tablet form what is available, they all are adrenergic drugs. ठीक है. जैसे your chlorpheniramine. ठीक है. Then pseudoephedrine, phenylpropanolamine, chlorpheniramine, etc. They are given as oral form. Plus point, the duration of action is more. It acts for a longer time. While nasal spray, you may need to take 5 to 6 times a day, depending on the condition. Oral tablet, once or twice daily dosing is sufficient. But problem bhi hai. What is the problem? Firstly, the onset of action. It is slow. It will take at least 1 to 2 hours for its onset. Second thing, as you are administrative systemically, so there may be systemic side effects. All these drugs has lots of side effects. Topical adrenergics. Prompt onset is very potent and sustained use over several days causes rebound congestion, making it the condition worse. Important advice to a patient. See, Otrivin, Nazevion, their advertisement is given in the TV very frequently, right? TV पे हमेशा देते रहते हैं ना. एक डॉक्टर आएगा अपना पता नहीं क्या, यही डॉक्टर है, यही डेंटिस्ट है, यही आयुर्वेदिक है, सब कुछ यही होता है. ठीक है. So he always comes and he'll say Otrivin. एक Otrivin ले लो, नाक एकदम साफ. तो listening to that, people don't ask any physician or treating doctors. So they just start taking it. But one important problem is that there is a rebound congestion. If you use this oxymetazoline and xylometazoline for very long term, it will cause rebound congestion. Means after giving that administration also, you will have more and more hypertrophy. So long term use is not at all indicated. These drugs should not be used more than 7 days continuously. After 7 days, the drug need to be stopped for a few days. Okay. So these are the examples: phenylephrine, xylometazoline, nafazoline, oxymetazoline, pseudoephedrine. So among them, xylometazoline, nafazoline, and oxymetazoline, they are the most commonly used drugs. Then topical nasal decongestant. Apart from this, we have intranasal steroids. Beclomethasone, furosemide, fluticasone. And also we have intranasal administration of antihistaminics. Any example बोल सकते हो? Intranasal antihistaminics. Write up the name azilastine. Azilastine. Remember which generation? Histamine is in your topic. Azilastine, which generation of antihistaminic? Azilastine, which generation of antihistaminics? एक हफ्ता भी नहीं हुआ ये हिस्टामिन का क्लास की. This is the second generation. It's second generation, don't forget. So mechanism, it causes constriction of the small blood vessels. The blood vessels which are surrounding the nasal sinuses, it will constrict. So as a result, there is tissue shrinks and the nasal secretion in the swollen mucous membrane are better able to drain. So as a result, better clearance of the sinus, maxillary sinus particularly. Then the hypertrophied mucosa is shrink so that the area becomes open up, and then nasal stuffiness is relieved. Okay? Steroids, direct anti-inflammatory or immunosuppressant action, and steroid needs a little bit late onset of action. So initial use of steroids should be associated with one use of nasal decongestant drugs. Indication, acute or chronic rhinitis, common cold, sinusitis, hay fever and other allergies. What is hay fever? Micro में discuss किया है? Did they discuss in micro? Hay fever? No, they will do, don't worry. So basically this nasal decongestant, is this a curative treatment or symptomatic treatment? Is it a curative treatment or a symptomatic treatment? Curative or symptomatic? Symptomatic. Good. This is not curative. This is symptomatic. Symptomatic treatment. Okay. So these are the side effects: nervousness, insomnia, palpitations, tremor, because they all are adrenergic drugs. So they will influence your sympathetic nervous system. So tremor is a very, very common side effect of that. Then steroids, local mucosal dryness and irritation. So दोनों ही long term use के लिए ठीक नहीं है. We should not prescribe these drugs for a long term use. It should be used intermittently. Okay, so these are the things. Apart from we have COPD. ठीक है. So COPD actually this will be more important in case of medicines. We may have only one or two questions that we may ask that explain why that anticholinergic drugs are preferred in COPD and adrenergic drugs are preferred in bronchial asthma. Okay. So I think I have already discussed this topic. Okay. And COPD का management बहुत लंबा है, so it will take medicine पे होने से अच्छा. ठीक है. Now, last question before leaving the class. If I ask you to prescribe for a patient suffering from common cold, what will you do? If I ask you to prescribe one prescription for a patient, adult patient who is suffering from common cold. Roll number 53, है क्या? Roll number 53. Okay, बोलो. क्वेश्चन सुनाई दिया? क्या कर रहे थे? क्या कर रहे थे? You have a patient, male patient of 34 years of age, suffering from common cold. What will you prescribe? क्लास फॉलो किया था? किया था? सॉरी? एंटी? पर्सन सफरिंग फ्रॉम कॉमन कोल्ड. क्या पैरासीटामोल ठीक है? ओके. विल यू प्रेस्क्राइब पैरासीटामोल? नो, विल आई एम आस्किंग ए फुल प्रेस्क्रिप्शन. जो चाहे बोल सकते हैं. You're prescribing. You don't ask for. We don't write home remedies in prescription. Class follow करो, exam आ रहा है, ऐसा नहीं चलेगा. 61? 61? Okay. एंटीबायोटिक लगेगा. So इसको ये बहुत बढ़िया प्रिस्क्रिप्शन बनेगा बिकॉज एंटीबायोटिक लिख रहे हैं. गुड. चलो पहले एंटीबायोटिक. चलो तेरा प्रिस्क्रिप्शन पेशेंट को बहुत अच्छा लगेगा, गारंटी. नेक्स्ट. Paracetamol is symptomatic because usually the person will suffer from fever. ठीक है. Then ठीक है. Montelukast. यहाँ पे क्या था? Just एंटीबायोटिक रेजिस्टेंस हो गया है. सॉरी. कोरेक्स. कोरेक्स डीएक्स. अरे कॉमन कोल्ड है, कफिंग नहीं है. इन कॉमन कोल्ड व्हाट इज द सिम्टम मेनली? नेजल ब्लॉकेज, राइनोरिया, फीवर. अरे सब पैरासिटामोल तो दे दिया. कितना दोगे पैरासिटामोल? टॉक्सिसिटी हो जाएगा. Ephedrine, nasal spray. Ephedrine नहीं, Oxymetazoline. That means we can give nasal decongestants. चलो, good, better. So firstly, you may or you may not give antibiotic. Keep quiet. You may or you may not give antibiotic. It depends on your own perception. Paracetamol SOS is compulsory because high chance that the person will suffer from fever. Symptom क्या होता है? Nasal blockade, rhinorrhea. So to prevent that, you may use one antihistaminic. You may use one antihistaminic and nasal spray of decongestant drugs. Antibiotic plus minus. अब खांसी है तो you may use cough syrup, and most commonly you should use antitussive drugs because the cough will be eaten non-productive cough. But suppose if the person has associated bacterial infection, then there will be productive cough. So in that case, you have to use certain mucolytic agents. ठीक है? Okay.